Post-discharge, it will take some time for a patient to get back to his or her old routine. During this time, it is important to know how much physical activity is appropriate. Each patient is different and therefore will heal differently at different speeds. Give your loved ones some time to recover fully and be patient when you go home. What are you up to? You're not supposed to lift anything more than 5 kgs.
Just getting some files.
I would have got them for you. There should be no pressure on your hands. You shouldn't stretch them as well.
For how long? I have to practice for the office cricket competition.
You go to work, but you shouldn't stress yourself by indulging in sports and running for another couple of months.
Can I walk at least?
Yes, you can walk thrice a day for about 10 minutes each time. And as it gets easier, you can walk for 15 minutes twice a day. But you should not exert too much. In case of pain, you have to stop immediately. So what are the physical activities you should avoid after a surgery? First, a patient needs to ask for help with lifting, pushing or pulling anything that weighs more than 3 to 5 kilograms for 6 to 8 weeks after he goes. Second, he can't twist his chest, reach his arms too far, or put pressure on his arms. Third, the patient should avoid vigorous activities such as sports. How many times to walk a day after returning home? When the patient first leaves the hospital, he should walk for 10 minutes thrice a day, then 15 minutes twice a day, and after about 4 weeks, he should be walking about 30 minutes once a day. However, this will be different for each person, and patients need to do a level of activity that feels comfortable to them and does not cause any warning signs like a racing heart. Initially, on leaving the hospital, the patient will climb slowly, but gradually, he or she will be able to climb a bit faster. The patient should use the handrail for balance and should not lean on the rail at all, as it is dangerous for the chest. Or it can also be easier to climb by facing the wall and holding the rail with both hands while climbing. After a surgery, it is okay to occasionally feel sad or depressed or frustrated. If the patient keeps feeling sad every day, then you might want to talk to your doctor. Second, as mentioned earlier, you can't do any positions that will strain the patient's arms or chest. So no sexual activity for a couple of months until the patient is able to walk 30 minutes comfortably. What are the things to take care of while climbing? The patient should use the handrail for balance and should not lean on the rail at all, as it is dangerous for the chest. Is it normal to feel sad sometimes after surgery? Some days your recovering family member may feel sad, and that is completely normal, and you should help encourage them to better their mood. However, if they feel sad all of the time after surgery, then you should contact your doctor. When is it appropriate to restart sexual activity? When 30 minutes of walk or climb up 2 flights of stairs is no longer difficult, you should avoid positions that strain the arms or chest region.